Any difficulty in study? Relax. Dental Anupam is here. Today we discussed about the 8, 9, 10, 11 and 12 cranial nerve in details. Now go to the facial nerve or 7 cranial nerve. Facial nerve is the 7th cranial nerve. This is a mixed nerve containing both sensory and motor fibers. Functional components: brachial efferent fiber for scalp, auricle elevation of the hyoid, facial muscles, buccinator and platysma, stapedius, stylohyoid and posterior belly of digestic. Special visceral efferent fiber for carrying taste sensation from the anterior two-thirds of the tongue. GVE fibers for carrying secretomotor impulse to the submandibular and sublingual salivary gland and lacrimal and nasal gland. GSA fiber for giving for carrying proprioceptive impulses. Now go to the origin of facial nerve. 4 nuclei located in the lower pons contribute to the formation of the facial nerve. One is motor nucleus, give rise to brachial efferent fibers. Nucleus of Tractus solitarius contribute special VA fibers. Superior salivatory nucleus give rise to the GVE fibers. Lacrimatory nucleus gave rise to general sensory efferent in addition to GVE fibers. Now go to the course of facial nerve. The course of the facial nerve may be situated under following five courses: intracranial, within the meatus, within the facial canal, at the stylomastoid foramen, and last but not the least on the face. First one, intracranial. After its origin at the pons, the motor root of the facial nerve taking a tortuous course, it runs upward and around the nucleus of the abducent nerve. Then it descends to emerge between the olive and the inferior peduncle and enter the internal acoustic meatus. Second, within the meatus, the two roots of facial nerve together pass laterally and the anteriorly with the acoustic nerve to the internal acoustic meatus within the meatus. The motor root lies in a groove above the acoustic nerve and the sensory root lies between the two. Here some twin of facial nerve join with the acoustic nerve. Third, within the facial canal, the facial nerve traverses through the facial canal. Initially it ran along with the lateral direction between the cochlea and vestibule, and courses towards the tympanic cavity. Then the nerve turn backwards and downwards to reach the stylomastoid foramen. The nerve present a radish shallowing called geniculum, where the direction of its course changes. At the stylomastoid foramen, the facial nerve exits the facial canal through the stylomastoid foramen. The nerve runs forwards across the external carotid artery and gives off branches behind the ramus of the mandible. At last, on the face, the five branch temporal, zygomatic, bacral, mandibular, and cervical nerves are give off by the facial nerve on the face, and those supply the muscles of facial expression. Now go to the branches of facial nerve. There are 11 branch of facial nerve. First one is greater superficial pectoral nerve. This originate at the geniculate ganglion and contains sensory fiber to the mucous membrane of the soft palate. It runs across anteriorly through the hiatus of the facial canal to the foramen lacrium, where it receives a tweak from the tympanic plexus. Within the foramen, it is joined by the deep pectoral nerve, which originated from the sympathetic plexus on the internal carotid artery to from the nerve of the pterygoid canal. The nerves to pterygoid canal transect the pterygoid canal and end in the sphenopalatine ganglion. Second is nerve to the stapedius. This is given off in front of pyramidal eminence of the ear and runs through a passage within the eminence to innervate the stapedius muscle. Third one, chorda tympani nerve. This originates during the downward course of the facial nerve behind the tympanic cavity at approximately 6 mm from the stylomastoid foramen. It runs upward and forward in a canal and enters the tympanic cavity. It travels across the tympanic cavity to exist through a foramen present at the inner end of the petrotympanic fissure called the canal of Huygens. Later it descends vertically down towards the medial surface of the sphenoid to remain between the lateral and the medial pterygoid muscle. Finally, it ends by joining with the lingual nerve. The chorda tympani carries the following fibers. One is efferent fiber received from the motor root which reach the submandibular ganglion to innervate the submandibular and sublingual glands. 2. Afferent fiber. More than efferent fiber that transverse through the muscles of the tongue to innervate the mucous membrane covering its anterior two-thirds. Fourth branch, posterior auricular nerve. This originated from the facial nerve as it emerged from the stylomastoid foramen. It traveled forward to run between the mastoid process and the external acoustic meatus. At this point, it communicates with the posterior branch of greater auricular nerve and the lesser occipital nerve. Later, it branches out as auricular and occipital branch. The auricular branch provides motor innervation to the posterior auricular and intrinsic muscle of the ear, while the occipital branch runs posteriorly to supply the occipitalis muscle. 5. Branch, digastric branch. This originated near the stylomastoid foramen and innervate the posterior valley of digastric muscle. 6. Stylohyoid branch. This arrays along the digastric branch and supply the stylohyoid muscles. Temporal branch. Those run across the zygomatic arch to reach the temporal region. They innervate the auricular muscle and communicate with the zygomaticotemporal branch of the maxillary nerve and auriculotemporal branch of mandible nerve. The anterior branch innervate the frontalis orbicularis oculi and corrugator muscle and joined the supraorbital and lacrimal branch of the ophthalmic nerve. 8. Zygomatic branch. Those traverse the zygomatic bone towards the orbit to supply the orbicularis oculi. Those branches communicate with the lacrimal nerve and the zygomaticofacial branch of the maxillary nerve. 9th branch, brachial branch. Those originate as multiple twigs and run forward in a horizontal direction. They consist of two groups of fibers. One is superficial branch that run beneath the skin to the supply the superficial muscle of the face, and deep branch that run at a deep plane and supply the zygomaticus levi superiorlis, buccinator and orbicularis oris muscle. Mandibular nerve. This runs below the platysma muscle and innervate the muscles of lower lip and chin. It also communicates with the mental branch of inferior alveolar nerve. Cervical branch. These lie below the platysma and gives off multiple twig over the lateral aspect of the neck which supply the platysma muscle. Communications of facial nerve. The facial nerve communicate with the glossopharyngeal auricular branch of vagus, great auricular nerve of cervical plexus, auriculotemporal nerve and laser occipital nerve. It also communicate with the terminal branch of the trigeminal and cervical supply skin. Auditory, vestibulocochlear or acoustic nerve, cranial nerve 8. The acoustic or auditory or vestibulocochlear nerve is the eighth cranial nerve. It is the purely sensory nerve which composed of two different type of fibers varying sensory receptor. One is vestibular nerve, second cochlear nerve. Functional components. GSA fiber is responsible for equilibrium and special somatic efferent fibers is responsible for hearing. Origin. The vestibular nerve is the nerve of equilibration. The bipolar neuron which give rise to this nerve are located in the vestibular ganglion. The ganglion is present in the outer end of internal auditory meatus. The vestibular nerve fibers are related in the four vestibular nuclei present in the pons and medulla oblongata. Further relay of fibers extend to thalamus and the cerebellum. The cochlear nerve is the nerve of hearing. The fibers arise from bipolar cell in the spiral ganglion of the cochlea present in the osseous spatial lamina of the ear. The nerve run along the internal auditory meatus along with the vestibular nerve and the across subarachnoid space and terminate in the cochlear nucleus. Two cochlear nuclei, dorsal and ventral, are present at the junction of the medulla and pons. Impulse from the cochlear nuclei get transmit to the thalamus and finally terminate into the auditory area of the cerebral cortex. Now go to the glossopharyngeal nerve or ninth cranial nerve. The glossopharyngeal nerve is the ninth cranial nerve. It is a mixed nerve containing both motor and sensory fibers. As the name denotes, it innervates to the tongue and pharynx. It carries general sensation from the mucous membrane of the pharynx, facies and palatine tonsil, and the taste sensation from the posterior part of the tongue. The nerve play a very important role in initiation of the swallowing reflex and secretion of saliva by the parotid gland. Functional component of glossopharyngeal nerve. One is brachial efferent fiber. Those cause elevation of larynx. And second is GVE fibers. Those are secretomotor to the parotid gland. Third is special visceral efferent, general visceral efferent and GSA fiber. They carry the taste fibers from the posterior one-third of the tongue and sensation from the mucous membrane of pharynx and the posterior one-third of the tongue. Origin of glossopharyngeal nerve. The glossopharyngeal nerve is connected to lateral and upper part of medulla by multiple filament. As it is a mixed nerve, the origin of the fibers is varies. First one is sensory fibers. Sensory fibers originated from the cell of superior and pectoral ganglia, which are situated on the trunk of the nerve. Somatic motor fibers arises from the nucleus ambiguous to join the fibers of the sensory root. Sympathetic efferent fibers, which are both preganglionic motor fibers and preganglionic secretory fibers, are from the dorsal nucleus. The secretory fibers reach the otic ganglion, from where arise the secondary neurons which supply the parotid gland. Now go to the course. From the medulla oblongata, glossopharyngeal nerve exits the cranium through the central part of the jugular foramen within a sheet of dura mater. Within the jugular foramen, the nerve enlarges to the from two ganglia, superior or jugular and inferior or pectoris. Now go to the of glossopharyngeal nerve. First one is tympanic nerve. Tympanic nerve, also called the nerve of Jacobson. The tympanic nerve emerges from the pectoral ganglion and reaches the tympanic cavity enclosed by a canal in the pectoral part of the temporal bone. Within the tympanic cavity, it split two numerous branches into from the tympanic plexus, which supply the mucous membrane of the tympanic cavity and mastoid air cells. Carotid branches. Those travel along and innervate the trunk of the internal carotid artery. Pharyngeal branches. Those from the pharyngeal plexus, which innervate the pharyngeal muscle and mucous membrane of the pharynx. 4. Muscular branch. This is the distal to the stylopharyngeus. Tonsillar branch. Those supply the palatine tonsil, soft palate, and passes through the tonsillar plexus. Now go to the vagus nerve. Vagus nerve or 10th cranial nerve. It is known for the extensive course across the neck, thorax and abdomen. It is the longest cranial nerve and name vagus. It correlated with the word vagrant that denote the wandering from one region to another. It is a mixed nerve with both sensory and motor fibers. Functional component of vagus nerve. First one is brachial efferent fiber for movement muscle of the palate, pharynx and larynx. GVE fibers for motor and secretomotor function to the bronchial tree and gut. Third, general visceral efferent fibers for sensation from the viscera. 4. Somatic visceral efferent fibers for taste from the posterior most region of the tongue and epiglottis. GSA fibers for sensation from the skin of the external ear. Origin of vagus nerve. Three nuclei in the medulla contribute the formation of vagus nerve. One is nucleus ambiguous brachial efferent fiber. B. Dorsal nucleus of vagus GVE and general visceral efferent fiber. Third one is nucleus of tractus solitarius special visceral efferent and GSA fibers. Now go to the course of vagus nerve. Vagus nerve arises 8 or 10 filament from the medulla oblongata below the glossopharyngeal nerve. Cranial course. All the filament of nerves arising at the medulla converge at the cranial level to form the nerve proper and exit the cranium through the jugular foramen. It passes through the foramen covered by dural sheath which it shared with the sensory nerve. Here the nerve lies in close association with the glossopharyngeal nerve which lies anterior to the vagus and is separated from each other by a thin septum. The vagus displays a characteristic swallowing within the foramen called superior or jugular ganglion. Further down below the jugular foramen, the cranial portion of the accessory nerve communicate with the vagus nerve to produce a second swallowing called the inferior ganglion or ganglionic nodosum. Thus the fibers of cranial part of the accessory nerve get dispersed to the pharyngeal and laryngeal branches of the vagus nerve. The vagus nerve descends along the neck enclosed with the carotid sheath. It remains positioned between the internal jugular vein and the internal carotid artery till it reaches the thyroid cartilage, after which it between the internal jugular vein and common carotid artery. The course of nerve different on the two sides of the body explained in the subsequent test. On the right side, nerve travel across the subclavian artery. It runs along the trachea and between the subclavian artery and the right intermediate vein to the posterior aspect of the lung to from the posterior pulmonary plexus. From here, nerve fibers ramify on the esophagus and joint with the similar branch from the opposite side to from the esophageal plexus. On the left side, the vagus nerve runs between the left carotid and subclavian arteries. It from the posterior pulmonary plexus behind the left lung, join with the nerves of right side in the esophageal plexus, and finally joined the hepatic plexus. Communicating branch of vagus nerve. First one is superior ganglion is connected to cranial portion of accessory nerve. Second, pectus ganglion of the glossopharyngeal nerve, facial nerve through its auricular branch, superior cervical ganglion. Second, inferior ganglion is connected to the cranial part of accessory nerve, vagus nerve, hypoglossal nerve and superior cervical sympathetic ganglion. Now go to the branches of vagus nerve. Vagus nerve give rise to the numerous branches as following level: head and neck, thorax, abdomen. Nerve arising at neck. Branches at neck. First one is meningeal branch, arises from the superior ganglion and supplied the dura mater in the posterior cranial fossa. Second one is auricular branch. It also originated from the jugular ganglion. The nerves emerge out through the tympanomastoid fissure and divide into the multiple twigs which supply the skin of the back of the ear and the posterior part of external acoustic meatus and tympanic membrane. Third branch at head and neck, pharyngeal branch. It given off from the upper part of the inferior ganglion. It is the principal motor nerve of the pharynx. When it reaches the upper border of the middle constrictor, it divides into multiple minor branch which along with the branches from the glossopharyngeal, sympathetic and external laryngeal nerve from the pharyngeal plexus. This plexus innervate the muscle and mucous membrane of the pharynx and the muscles of soft palate except the tensor veli palatini. The superior laryngeal nerve also arises from the inferior ganglion. It receives some sympathetic fibers from the superior cervical ganglion. It reaches the lateral aspect of the pharynx to branch out into the external and internal laryngeal nerve. Fifth, cardiac branch are two groups, superior and inferior cardiac branch, which are give off the upper and lower part of the neck respectively. In addition, more cardiac branch arise from the vagus nerve at the level of superior mediastinum and from the recurrent laryngeal branches. All the cardiac branches terminate in the cardiac plexus, which supply the heart. Branches of vagus nerve in abdomen. No, sorry. Branches in vagus nerve in thorax. First one is bronchial branch and second is the recurrent nerve. Bronchial branches combine with the sympathetic fibers to from the pulmonary plexus which supply the lung. The recurrent nerve tracks different routes on the right and left side. On right side, the nerve originate at the level of subclavian artery. It runs around the vessels and moves upward toward the trachea. On the left side, it is given off at the level of the arch of aorta. The nerves on either side run upward in the groove between the trachea and esophagus and reaches the larynx to supply the muscles except the cryothyroid muscles. The recurrent nerve right and left gives off multiple cardiac filament to deep part of the cardiac plexus as well as branch to esophagus, trachea and pharynx. The recurrent laryngeal nerve is closely associated with the lower pole of the thyroid gland. Therefore, it has to be carefully preserved during thyroid surgeries. Now the branches in abdomen. First one is esophageal branch. Join with the similar branch of opposite side to from the esophageal plexus from where nerve are distributed to esophagus. Gastric branches join the gastric plexus which supply to the stomach. Right and left vagus nerve from the posterior and anterior gastric plexus respectively on the stomach. Coeliac branches join the coeliac plexus and innervate the pancreas, spleen, kidney, suprarenal bodies and intestine. Fourth, hepatic branches join the hepatic plexus and innervate the liver. 11, cranial nerve or spinal accessory nerve. The accessory nerve is the 11th cranial nerve. It is the motor in function. Functional component. The nerve carries special visceral branchial fibers through both cranial and the spinal root. Cranial root. These serve as the adjunct to the vagus nerve and supply the muscles of the palate, pharynx, larynx and heart. Spinal root. These supply the sternocleidomastoid and the trapezius muscle. Origin. Cranial root. The neurons contribute to the cranial part of accessory nerve are present in the nucleus ambiguous. Spinal root. This arises from the spinal nucleus located on the lateral part of the anterior gray column of the spinal cord from C1 to C5 levels. Course. Cranial part. The nerve fibers of cranial part arise at multiple twin from the lateral aspect of the medulla. just below the origin of the vagus nerve. Later, the rootlet merged from a single nerve trunk during its exit from the medulla. It is accompanied by spinal part and the glossopharyngeal nerves. During its process through the jugular foramen, the fibers of cranial part intermingle with the fibers of the spinal part. At this point, it is also linked to the superior ganglion of the vagus nerve by a few nerve filaments. As it emerges out of the foramen, it separates from the spinal portion of the cranial part, descend further, get fused to the vagus at the level of inferior ganglion. Spinal part. This is the larger than cranial part. First, the fibers of spinal part after their origin from the lateral spine cord merge to from a single trunk in vertebral canal. These run upwards and between the dorsal nerve root and the ligamentum denticulatum to enter the skull through the foramen magnum. Later it courses laterally towards the jugular foramen along with glossopharyngeal and vagus nerve. As discussed earlier, within the foramen, it shares its dural sheath with the vagus nerve. Although a layer of arachnoid separates the accessory nerve from the vagus nerve. Also, here it fuses with the cranial part and receive filament from the cranial part. 4. But it immediately separates from the cranial part, it emerges from the jugular foramen. From the foramen, the nerve runs downwards between the internal jugular vein and the internal carotid artery till it reaches a point between the angle of mandible and the mastoid process. The nerve now traces a posterior course lying below the sternocleidomastoid muscle, finally piercing the upper part of the muscles where it communicates with the spinal nerve C2 and C3. The nerves that enter the posterior triangle of the neck, running inferiorly and posteriorly. Furthermore, the spinal part exhibits the triangle 5 cm above the clavicle to remain under the trapezius muscle and from a plexus with the third and fourth cervical nerve from the where the muscle receives its innervation. Branches of the accessory nerve. The spinal accessory nerve is a entirely motor nerve. Its muscular branches are: first one, branch to the sternocleidomastoid muscle, branch to the trapezius muscle. In addition, region innervate through the cranial part of the accessory nerve as palate, pharynx, larynx, heart. Now go to the hypoglossal nerve or 12th cranial nerve. The hypoglossal nerve is the 12th cranial nerve. Its functions are exclusively motor and it is the major nerve supplying the muscles of tongue. Functional component: general somatic efferent fiber. Those are motor fibers arising from the hypoglossal nucleus and innervate all muscles of the tongue except palatoglossus. Second, general sensory fibers. Those carry the proprioceptive fibers from the tongue to be relayed at the spinal nucleus of cranial nerve 5. Origin of hypoglossal nerve. The fibers of hypoglossal nerve arises from the hypoglossal nucleus, which lies in the medulla, deep to the hypoglossal triangle. They emerge as numerous rootlets from the vertical groove between the pyramid and the olive. Those fibers then converge to form a bundle that presses the dura mater and exits the cranium through hypoglossal or anterior condyle canal. Course: after exiting cranium, the nerve descends down vertically between the internal carotid artery and the internal jugular vein till the reach the angle of mandible. The relation of hypoglossal nerve with the glossopharyngeal nerve, vagus and accessory nerve are interrelated. At this level, it lies between the posterior belly of the digastric muscle and run across the internal and external carotid artery, and the prominent loop formed by lingual artery to enter the submandibular region. It curves above the level of the greater corner of the highway to travel anteriorly. Furthermore, it runs between the mylohyoid and the hypoglossal muscle to finally reach the floor of mouth. Here the nerve remains inferior to lingual nerve, submandibular duct and deep part of submandibular gland. It terminates by sending branch to the intrinsic and extrinsic muscles of the tongue. A special feature of hypoglossal nerve is the formation of a thin nerve loop at the neck called the ansa hypoglossi. The loop is formed by a superior and an inferior root. The superior root is an extension of hypoglossal nerve and carries C1 fibers. The inferior root is formed by fibers from spinal nerve C2 and C3. The two roots unite and from the lobes in front of common carotid artery. Now the branches of hypoglossal nerve. The innervating fibers of hypoglossal nerve may be categorized into two types. First one is branches of the hypoglossal nerve proper, and second one is branch contain the spinal nerve C1. First, branch of hypoglossal nerve proper. Those are thin, delicate muscular branches which the innervate the following from the inferior surface of the tongue, extrinsic muscle and intrinsic muscle. Branch containing the spinal nerve. First is meningeal branch or dural branch. Second is branch to thyrohydrate and geniohydrate. Third, branch from the descending hypoglossy and branch from the ansa hypoglossy. Last, the communicating branches. The hypoglossal nerve communicate with others nerve through its branches, either by giving off a few nerve fibers or by receiving a few branches from other nerves such as the vagus, lingual, sympathetic and cervical nerve. Thank you.